And good morning and welcome to Western New York Living. I'm your host, Janet Snyder, and I want to thank you all for tuning in on this Monday morning. Today is October 15th, and you still have exactly 15 days to pick up some treats for this year's Halloween trick-or-treaters while you ponder if it's going to be Milk Duds or Reese's Cups. Here's a peek at some of the guests we've lined up for today. Kalos Health will be in studio today to discuss what seniors need to know about the Medicare open enrollment season. Plus, they'll discuss what's unique about their Medicare Advantage plan. If you're tackling some home improvement projects around your house, then let Value Home Centers help. They'll be joining us to tell us about their fall value days where you can save big on paint, storage bins, insulation kits, and so much more. Also ahead on today's show, if you are looking to have your windows replaced, then William C. Rottenson will be here to tell you what they do differently to make your replacement windows last. And a little later on, the law office of Ralph Larigo will be joining us in studio to clear up the many questions you might have about matrimonial and family law. But before we get to any of those great questions, I have a question for you. Are you finding it maybe a little more difficult to hear the TV than you have in the past? The reason I ask is because many people don't realize they suffer from hearing loss. And my first guest understands this all too well. Joining us now from Hearing Evaluation Services of Buffalo is Dr. Jill Bernstein. Thank you so much for being here.
Thanks for having me.
So Dr. Bernstein, tell us about the Hearing Evaluation Service of Buffalo and what you provide.
Hearing Evaluation Services of Buffalo has been serving our community since 1981. We're one of the few nonprofit practices in the country that's a freestanding audiology practice, and we are devoted to making sure that everybody's hearing needs and if they have tinnitus or balance problems are met in the best possible way.
So when you say not-for-profit, what's the benefits of seeing a place like yours?
So when you come to us, you know that there's no personal motivation for you to buy really expensive hearing aids or anything like that. I don't work on commission, I don't work on quotas. It's just my job to come in, give you all the options that you have available to you, and help you make the right choice for whatever your personal listening circumstances are.
And you talk about circumstances, a lot of people are confused at what their health insurance covers.
Right, so this is open enrollment period. It's perfect timing to talk about that. Insurance is really confusing, even for me.
And me.
A lot of jargon like benefits and discount programs and co-insurance. And the best thing is that we actually have an insurance specialist on staff to help make sense of that for people, to translate that jargon into meaningful terms. And she's available anytime by phone or by our website. We have a little button you can click. And in fact, to help people prepare for open enrollment and to understand their options, we have 2 informational seminars that we're offering in the North Towns and the South Towns on November 6th and 13th. As people try to understand the benefits that are being offered.
Because a hearing aid is an investment, but you want to get the one that's right for you, regardless of if it's the cheapest or the most expensive. You want the one that works for your ears.
That's right, and there are more and more insurance sort of contributions, and helping people understand what that means, whether it's the insurance company contributing something or giving them access to discounted hearing aids. It's our job to help you understand exactly what that means, and if it's discounted hearing aids, understanding what's available to you, that you can come to us for any of those things. We honor all insurance companies' discount programs, even though they might tell you you have to go to a particular place. That's just not true, especially if you've been a patient of ours for 10 years. We don't want anyone to feel like they have to go someplace else.
Isn't that so? It's so frustrating.
It's really frustrating.
Biggest misconception when it comes to insurance coverage for hearing services, what would you say that is?
I think the misconception is that some companies, again, tell people you have to go to this location to get this plan, and that's not true. Again, if they just call our office, we'll help them understand what the benefit is or what the discount is, and they can always come in, and we'll make sure that when they come to us that we tell them all their options, the discount program and everything else, because sometimes those discount programs are the right choice for someone and sometimes they're really not.
I couldn't even tell you if my health, does health insurance cover hearing aids?
It all depends on the insurance program, and again, with open enrollment, every year they're adding new benefits or changing benefits. So the best thing to do is to call our insurance specialist. She'll look up the insurance plan that someone is on and then, again, interpret that into a meaningful way, because what they describe is often very misleading and hard to understand for the average consumer.
And now, on top of that, somebody who might not realize they have hearing loss, what's one sign?
Most common sign is that you think that people mumble or that you do fine except you're in background noise. Those are the 2 most common signs. of the start of hearing loss, and that's when you need to come in for your hearing test.
Always good information. Thanks for being here today.
Thanks so much.
All right, if you're noticing you may be suffering from hearing loss, it's time you contact Hearing Evaluation Services of Buffalo. Head over to their website, which is hesofbuffalo.org, to find out more about all the services they provide. They have offices in Amherst, Williamsville, Orchard Park, and Tonawanda. Also, they're offering 0% interest-free financing for 36 months when you purchase a new set of hearing aids until December 31st. Now stay right there. Coming up next, Kalos Health will be joining us to talk about the different types of health care and coverage and services they provide for people interested in Medicare. Western New York Living will continue.
Special consideration for today's show paid for by the following: